Hey, Charlotte Lately, this is Deidre Dickey. We are here with Juliet. Juliet is here because this is our Mental Health Awareness Month documentary. We just wanted to have a conversation to bring awareness to the stigma of mental health, and we have Juliet here to help facilitate that conversation.
That's right.
Welcome.
Thank you. I'm so excited to talk about this because it is my mission is to try to help end the stigma, and so thank you for inviting me.
Absolutely.
Yeah.
So go ahead and introduce yourself and all your licenses and all the things, who you are, who you be.
All the random letters behind my name.
Yes.
So I'm Juliet Kuhnle, and I'm a licensed clinical mental health counselor, supervisor. And I've been practicing for a little over a decade, and I have a private practice in South Park called Sun Counseling and Wellness. And we have about 6 mental health therapists, a dietitian, a spiritual director, and an integrative health coach. And we really just try to have a really holistic practice and be able to say yes to whatever presenting issue comes through the door.
Okay, so let's talk about that.
Mm-hmm.
What are all the things? Like what
Yes.
how does one know they need therapy? Like what does that look like? How do you know?
Right. Oh, that's such a good question because I think it can come to somebody at different points in their lives, right? So it's a very unique, individualized thing. A lot of times there are people who will wait till they're in crisis and feel like, I can't even feel the floor beneath my feet. I need help. That's fine. Sometimes there are people who want to do it sort of proactively, just for deeper self-exploration, self-awareness, and to learn some tools. That's fine. I mean, the theme is it's fine. Anytime is fine. But I do think that we get this message in our society that there needs to be something really wrong. And so I always tell people, like, you don't have to wait for the crisis. There doesn't have to be some diagnosis or something that you can really just point to that, is shaking your world. You can come just because why walk through things alone? I mean, life is hard.
So if you could give a definition as to like what therapy is and why we should therapy, what would you say?
Why we should therapy?
Yeah, what does that mean?
Oh gosh, because I believe everybody should therapy.
So I
like
guess
it
we
as
could
a
just
verb.
start with like
Yeah.
basic, like what is therapy?
What is therapy? I think I see it as a collaborative process where the therapist or counselor, which those words can really be used interchangeably, walks with you in your story, in your journey towards growth, healing, greater self-awareness. I tell my clients, I'm actually not the expert in the room.
Wow.
You're the expert. You're the expert of your life. I'm just a facilitator that, knows some tools and some skills and kind of helps you pick out some patterns as you're talking. But you're the expert. So therapy, in my definition, is a collaborative process to wholeness and wellness.
I love that. So you said at any point therapy can happen. So when's the most important? Like how do we know, like when should it start? Childhood, adulthood? When does one start therapy?
Yeah, I mean, I think it depends on what you're looking for. I mean, so we do see a lot of children and youth, adolescents, teens. That tends to be if they are struggling with something in particular, increased stress and anxiety, behavioral issues, activities of daily living, which are like showering and doing your homework. Like those things are hard to keep up with. So that tends to be when we see younger people. But I guess it's hard for me to really answer that really specifically because I don't think there's ever a wrong time.
So the right time is now.
Yes, because I think that's part of this, again, part of the stigma is I don't want people to think you have to wait for this lightning bolt or for your world to fall out from underneath you. There is a purpose of therapy for any stage of life.
I love that.
Yeah, because someone can just walk alongside you and help you with tools or help you enhance what's already good or make sure your foundation is really solid all the way to helping you heal from a trauma. So I think there's never a wrong time.
Right. Why is there such a stigma concerning mental health?
Oh gosh, I think there are a lot of layers to this. And I come at it from this angle, like it doesn't make sense, right? Because when you think about health, of course our mental health should be at the forefront, in my opinion, because that's our emotional, psychological, social health, and none of the rest of it doesn't matter if we're not tending to our mental health. But yet, I think there are these different layers. There's the way that media portrays it. We tend to, if you think about movies or TV shows, it tends to be very violent or negative and scary.
Yeah.
And so people think that it's not relatable, or I can't act like that's me, any part of me, because then there'll be so much judgment. So I think there's that. I think there's institutional stigma where opportunities for people with mental illness are fewer. They're because of the stigma. So then everything kind of gets perpetuated. Yeah. And then there's the way that we talk about it. I think the language really matters. If you think about when people kind of casually reference people who are crazy or sweet but a little bit psycho,
Right.
like, like it's catchy, but it's like that stuff matters. It's offensive, and it does perpetuate this idea of, well, I don't want to be that. There's something wrong with that. Right. So all of these things add up to be stigmatizing, and then that adds to the shame that people feel. And then there's fewer people that access treatment because of that, and it's just a whole cycle that I truly feel, Deidre, that it's changing though in the pandemic.
Absolutely.
Yeah.
I started therapy in the pandemic.
Yes.
Which is so crazy because, and I say crazy, but I don't mean it like that.
I gotcha.
But I grew up thinking therapy was like bad. You got therapy if something was like wrong.
Right.
And when it was approached to me, it was like because of a traumatic incident. It's like, so XYZ happened, so now you need so you can go on. You know what I mean? So it made me feel so broken.
Yes. Or questioning, like, do I really need that?
Right.
Do I have problems?
Do
my problems count? Are they bad enough?
Right. Are they bad enough?
Yes.
It was really the one that I struggle with the most. Like, are you sure that really constitutes therapy? Like, I didn't understand. So if I could tell Deidre when she was, 8, 10 years old, go ahead, baby, go to therapy.
Yes.
Do therapy, don't wait.
Yes.
Because honestly, it was like the collective timeout that we were all in that was like, I have thoughts.
That's
all
right.
these thoughts, and I don't know where to put them and who to give this to like help me like work
to tease
through
it
them.
out, work through it. Yeah.
Because I don't want to put all that, because we spend a lot of time obviously with our families and stuff. And as I was learning my girls, I have 4 of them. For the longest, I called them the girls.
Yeah.
But I realized they're individuals.
Yeah.
And as we were learning their individual personalities, it made me like introspectively like look at myself like, who is Deidre?
Ooh. Ooh, yes.
Who is Deidre?
Yes. Which is like super overwhelming, right? And like, how do I figure that out? Yeah.
Hence the therapy.
Yes. And I think it's that, right? It was the stillness of the
Mm-hmm.
past year that was forced upon us. So the slowing down.
Right.
Because a lot of it is we wear busyness as a badge of honor in this society, and we go. And a lot of that really, when you look at it, is about trying to outrun the discomfort. Wow. And so the slowing down was kind of like, oh, okay, there's my stuff. And so what do I do with it?
Knocking on.
Yes.
Hello.
Yes. So there's my stuff. And then we were all going through this traumatic experience together for the first time. And so people were letting go of just the like, I'm fine, and just kind of owning the struggle a little bit differently. And so that's what I feel is turning. And that's what I'm like, whenever and wherever I can scream from the rooftops, like, let's jump on that so that it's more than just a moment.
Okay, so let's jump on that. How does one access therapy?
Yeah. Oh, yes. I know, because then when you finally make
Right.
the decision, it can be super overwhelming because there are a lot of great therapists out there. So I think there are a couple things. You think about where you can start with asking for referral sources, because you want it to be, this is something that I tell people all the time, like, actually, we were talking about the letters behind my name. None of that matters, really.
Okay.
I mean, it means that you want somebody to have training, you want somebody to be licensed, all of that, of course. But what I mean ultimately is, if you don't feel connected and you don't vibe with your person, you're not going to get anywhere. Because
And it's okay to look for someone else.
Oh my
like,
gosh,
don't
yeah.
feel like you're locked into the one.
Yes.
Okay.
And I tell that to people from day one. I'm like, you're not going to hurt my feelings. This isn't about me. We don't take it personally. You have got to click, because that rapport and trust to get into that collaborative process. So no matter what someone's training is or where they went to school or whatever, like, if your personalities don't click, it doesn't matter. So that said, I think, a lot of us offer free meet and greets so that you can get a feel for somebody's vibe. And then, you might go through a few sessions and then be like, But there are too many options out there to not be feeling it. But I tell people to start with your doctor, to ask who they refer to. You can go online, which to psychologytoday.com, but it's very overwhelming. But it's a nice place to start. You can filter what gender, what specialty, what insurance, if you want to use insurance, that kind of stuff. But I think just asking around too. especially as more people are being more open about it.
Right.
Who are you seeing? And then I love when people come to me to ask, and even if it's not me or someone in my practice that ends up seeing them, I like being that person that can point them in the right direction too.
So we really need our friends to not hide their therapy. Don't put it on their calendar like hair appointment.
Right.
Getting my nails done. Like, go ahead and put it in your calendar, therapy, and like be okay with like answering the question, yes, I do therapy.
Yes,
this is my person.
Yeah. Well,
you should therapy too.
Right. And it's so funny when people are like, you see a therapist? Like, therapists see therapists? I'm like, yeah, P.S., by the way, I'm human first. Like, before anything else.
Dispel the shame.
And you better believe, like, carrying everybody else's trauma amidst my own trauma this past year, and with my own, again, I'm human first, so I have my own insecurities and my own childhood trauma and my own shame and my own anxiety and all of that, and I have to know what to do with that to be present.
Do you have a therapist?
I do have a therapist.
So a therapist can have their own therapist.
Yes,
love it.
And I think that's a great sign.
Yes.
And I think I'm not going to sit here and say like they should, because I don't think it means anything about a therapist if they don't. But I think the best therapists are ones that have done their work, and the work never ends. So it's not like you check it off, because life is constantly throwing us curveballs, and suffering is the one guaranteed thing in life. So so therapists that continue to do the work, I think, are the best, the most present.
I love that. I love that. Okay, so we know to ask our doctor or our friends, like, who are you seeing? But like, once you do find the person, what should be some initial questions that you ask your therapist?
Right. So if you know what some of your presenting issues are.
Okay.
So this is either going to be like there was a trigger, some kind of situation that I need to process or I'm going through, or I think I might be feeling anxious or depressed. If you know that specific presenting issue, it's good to ask about their experience with that.
Okay.
Because it's within our ethics to have to say that's outside of my scope of practice, for example. So substance use is not one of my specialties. So if somebody comes to me with that presenting issue, I would refer them out. So if there's something like that, you want to ask directly if they have experience. You might kind of track what's important to you. So if it is important to you to understand how long they've been doing it, where they did go to school or whatever, you can feel free to ask any of those questions. When I have done this to sort of vet out my own therapist, I just chat. Because I just kind of want to know the style. And actually, this is kind of, I don't even know if this is appropriate to say, but I will ask, like, is it okay if I cuss? Like, do we cut?
Right.
Because when I get in a space, like, it's going to come out.
Right.
And, like, I want to know that I'm not going to be judged and that I can just let it flow.
Right.
And so if there are things that are important to the way that you communicate or just to what makes you feel safe and comfortable, ask it. I can't think of anything anybody's ever asked me that was sort of like, because I don't know what's important to somebody else, and that's the whole point, is to be a judgment-free zone. You could ask what kinds of interventions or theories that we use, but most people don't tend to even know what that really means. So if I say I use CBT and ACT therapy and DBT, you're like, okay, alphabet soup, I don't really care.
Right.
But some people do. Some people know that CBT has worked for them or whatever. So you could ask that, and and you could have them sort of explain that to you, and then you can discern in the way that they're explaining it to you if that sounds like something that would match what's going on for you.
And then I think another question that would be asked is, well, how long is the therapy process?
Right. How long are we going to be doing this?
What is a recommended amount of time for you to see a therapist?
That is one of the questions we always get.
Yeah.
And I don't know, right?
Okay.
Until we can really assess what's going on and really discern where you are in your stages of change. Like, are you ready and willing to implement things to change, or are you sort of still contemplating, or what? So it's hard to say.
Formula.
Yeah.
But a lot of us get that in our brain. Like, I go 4 times, I'm healed.
Of course. And girl, I would be a billionaire if
so true.
If I could just be like, boom. But and there are some interventions that are protocols that are kind of created around like 12-week programs, for example. So there are some times that you can kind of estimate, here's when we'll kind of work through this this system or this protocol. But we will be talking about something on session 3 that you think we're talking about X, and boing, here, 13 other things that you were like, ooh, wow. I didn't know we were going to get there, Yeah. And so you as a therapist, you have to be able to follow whatever comes up. And so it's hard to say. So this is the answer I usually give is, plan on weekly, because if you're showing up, I want to jump on that motivation. And the goal is to work myself out of a job, right? I want you to feel like you got this. You got tools. You can call me when you need me, but we will collaborate together to figure out when we can decrease frequency.
I like that. I do. Work you out of a job.
Right? I mean, that's the thing, because it's, you want to get to a point where, as much as I like hanging out with you and doing our thing together, you don't want to see me. Right? I mean, ultimately.
Right.
Like this, because that means you feel equipped and empowered with what we've learned in our work together.